So you guys will see that recording button pop up now. So my name is Sarah Kirsting. I'm really excited today to be introducing Dr. Charles Blair. He's a great friend of eAssist, and we have been very lucky to work with him for a very long time. So he offered to do this webinar today for all of our eAssisters, which are our team members, as well as all of our eAssist clients, so that everyone who needs to know this information in the eAssist family will be well informed about coding for dentistry, or teledentistry rather, especially and specifically during the COVID-19 crisis. So if you guys have a question at all during this presentation, you can drop it in the Q&A section at the bottom. You'll see a little bubble there. If you drop a question there, when we get to the Q&A, we'll read through all of them, and Dr. Blair is being very generous with his time to answer as many as possible. And that's the only housekeeping information I have for you. We will make sure slides and recording are shared with you all. So Dr. Blair, whenever you're ready, you can go ahead and take that away.
Okay, thank you so much, Sarah. And I'm so happy to be here with eAssist today and to present to you a little program. It's going to run less than an hour on coding for teledentistry. I'm also going to give you two other bonuses. We're going to talk about charging separate for the PPE fee, and we're going to have a couple words to talk about the certificate of waiver. ADA is releasing 2 new codes June 1 for testing of the virus in the dental office. So we're going to discuss all of that today. I am going to be very, very repetitive. I'm going to say things sometimes 2 and 3 times because this can be confusing. The chat rooms out here are just full of a lot of misinformation. So I'll try to give you the latest and greatest as we look at these topics on a constant basis. First is just a disclaimer. Of course, I'm not a healthcare attorney, and we're not giving any kind of legal advice. I'm going to give you some opinions of mine throughout the program, but we're giving no legal advice today. Also, on the coding, we've really researched it, but hey, just because we say this is going to work the best does not mean it will work in every situation. There's a tremendous amount of variation, so there's no guarantee that a given plan is going to go along with what I have to say today. The ADA's mantra is code what you do. So we turn in exactly what we did on the claim form. If you do a pan and bite wings, that goes on the claim form. Then when the payer gets that claim, they can pay an alternative benefit of a full series amount of money if they want to. So insurance companies can't change the code, but they can change the benefit. They can change and say, we're not paying for this, but we will give you a benefit of X number of dollars. So you do want to follow the CDT code set. The ADA releases the codes each and every year. So we have a new code set. There's new codes, deleted codes, revised codes. So follow the latest. So I want to warn you, this is a changing landscape. I've also got a date here on the seminar, 4/28, and right now we're giving this a couple of days later than this date. And as I speak right now, our presentation is up to date. But I want to tell you, it is such a changing landscape. And check with the ADA website throughout this crisis as they have updates as information becomes available. Another thing I'm going to present here is a number of the codes that the ADA lists. There's a potential of many codes, but the thing is, one code might work the best, one code might pay better. Since I'm independent, I can give strategies. So I'm going to present strategies, my interpretation of what I see as the ADA describes the various codes that can be potentially charged for. So I want to simplify things today. I want to try to decrease the confusion regarding teledentistry and the other 2 topics that I'm going to talk about today. First, what about our sources for guidance? The ADA and the State Dental Society are essentially bully puppets, so they can make recommendations, this type of thing. They do not have the force of law. Your malpractice insurance company is very important because they cover you for your dental practices and your acts and your procedures. The dental board, at the end of the day, is who licenses the dentist and the hygienist, and in some states, assistants, and so forth. So the state dental board is the one that you really, really need to look toward and listen to your malpractice insurance company. Those are what we call authorities. And so the authorities will determine what you do, and you are regulated by the state dental board. So what codes might apply to a virtual appointment? But today, we're really focusing on these. There are two codes. D9995 is teledentistry. That's a synchronous real-time encounter. And then the 9996 is asynchronous. The information is stored and forwarded to the dentist. So which one counts today of the two? Which code would apply to the dentist interacting with the patient with teledentistry? Answer, 9995, the teledentistry synchronous real-time encounter. How do we put this on the claim form? The ADA has given us instructions. Basically, we place 9995 on the line below the service that we rendered. I'm using here as an illustration code 0140, the problem-focused exam, and later we'll find that's probably the best code to use, so I'm using that in this example on this slide. And then we put 9995 on line item number 2. Also, to be a place or to be a teledentistry code or claim, we need a place of service. And the ADA instructions, there's roughly about 80 places of service. I could do a service in a nursing home, in a hospital. I could do it in my dental office. So your Dentrix, by default, turns in 11. 11 indicates a dental office. But to be a teledentistry claim form, we need the place of service to be 02. Now, how tight are the companies out here on these particular items here? And there may be a little variance, but I'm kind of giving you the gospel of the actual official directions of how to do this. Left unsaid on the 9995, what about a fee? Do we leave it blank? Do we put a 0? Do we put a fee in there? Again, there may be some variations with the payers. Also, certain softwares might not transmit a 0 fee. So just wanted to give you a little bit of troubleshooting there where you might have to talk with your Dentrix service center or your Open Dental, whoever you are dealing with there in your office. So what about charging a separate fee? Well, the short answer is yes, a fee can be charged, but currently the reimbursement by payers is extremely low. Plus, is it kind of piling on to even charge a fee? So I want you to stay tuned because I have kind of a separate section later where we're going to talk about fee strategies. Remember, just because there's a code does not mean necessarily we're going to charge for it, and not necessarily would a payer pay for that code. We've got over 700 codes. The typical GP files about 90 codes, and about 20 codes is 90% of your money that you collect from patients. So let's look at some of the codes. The ADA gives us a variety of codes on their website. I want to cut to the chase, though. I'm independent. I can tell you which of these codes might pay a little better, might be a little better reimbursement, so that's what we'll do. Code 140, overall, like I said, is excellent. Code 170, the coverage overall is very good. Now, what is the 170? That's a re-exam. A lot of offices don't use this code, don't know about it. It's appropriate to use this in a typical office, a one-doctor office, maybe 5 times a year, 7 or 8 times a year. So it's a code we don't use a lot. It's a re-exam. It's limited problem focused. It's an established patient. I kind of teach by example. So what's an example of code 170? A kid comes in today with trauma. He's got a busted lip. Number 8, number 9 are slightly mobile. I tell the parent, Johnny, has got some trauma today. A couple of these teeth are slightly mobile. I want to see him in 4 weeks. the trauma guidelines is to see a kid about 4 weeks later, and let's double check these teeth at that time. When the patient comes in, I charge $170 for that exam, and typically we would charge it, and of course it would typically burn up an exam. A second example might be a follow-up on a lesion. So what is the coverage for $170? Overall, it's very good. We've also got another code. I call it more of a trash code. It's a re-exam. It's post-operative office visit, and just virtually no coverage. But we use this code a lot because it's a follow-up to treatment. So I pulled a tooth last week. This week I'm checking the pest, I'm removing the suture. That's typically in my global fee. I'm not going to charge today. I'm not going to send in 171 to the 0171 to the insurance payer because there's no fee today. So it's kind of a trash code, and we're going to use that code a good bit, but typically no charge. It could be a post-operative visit after delivery of a denture and such. Now, what about audio means only? If we're just talking to the patient over the telephone, we're not seeing them, is there any kind of code? Well, screening of a patient, it would be very poor coverage, virtually none, or an unspecified diagnostic procedure, D09999. And remember, these 99 procedures often are not payable. And so, again, I'm trying to cover the potential codes that are listed on the ADA website, but I want to focus down and simplify, though, which codes would probably work the best and be the most appropriate, be the most correct. A call center, someone calling in, is that billable? Well, code 0190 might be, but again, very poor. Code 09999, again, coverage virtually none. So going down that pathway is not going to work, and I think, too, patients would not be happy talking with somebody in the office, talking with the front desk, and then getting billed for something like that. So we don't want to go down that pathway. So is there an evaluation code available to report? Yes. The reality is that ADA does give us these possibilities. I've covered the ins and outs of these three codes. So what about, is one of these procedures superior? Is one of the codes I've discussed the best from a reimbursement overall by most payers? Would one of the codes maybe have a higher reimbursement rate than the other evaluations? Yes. The winner? The winner's code 0140. The limited oral exam, problem focused, that is the winner, if you can comply with this code. Now, what are the typical limitations for evaluations? Do insurance companies pay? What if Ms. Jones comes into my office for 10 emergency visits? Well, is insurance going to pay for that? No. Could I charge her for 10 visits? Yes. But insurance typically has limitations. The most common is the payer says, we'll pay 2 evaluations per calendar year or 1 evaluation per 6 months. Now, a very few of the plans, though, may cover 2 emergencies plus the 2 routine checkups. So a few plans would pay beyond the typical limitation of 2 per year. So what about with COVID-19? What are the current limitations? Well, like I said on the earlier slide, this is a changing ball game, to say the least, but here's the good news. A few plans, a few payers at this point have waived these traditional limits, and they now cover additional evaluations. Now, for some of them, they say we're only going to cover these additional evaluations for like a 2-month period. So there are some handcuffs. What other codes have been mentioned for teledentistry consideration? Well, we've had a code for about 100 years, and it's the office visit after regularly scheduled hours, code 9440. The intent of this code is where the doctor has had their open hours let's say I work normally 4.5 days a week. On Fridays, we leave, we come in a little earlier, we work straight through, we leave at 1 o'clock on Friday. I go home, I'm getting a sandwich. In the meantime, somebody calls me and says, hey, my kid had an accident. Can you come to the office? I say, of course I will. So I call my dental assistant. I say, meet me at the office. Ms. Smith's boy, Johnny, you remember him? He had an accident. Let's go to the office. So what did I do? I returned after normal hours, and I came back, and I reopened the office. There, I could charge $9,440, and then I could charge any procedures that I did at that visit. But the reimbursement for this is fairly rare, but even some of the deltas cover this. For instance, the Hawaii Dental Service, Hawaii Delta Dental, they cover this. Now, what you don't want to do, though, is to abuse this code and say, well, we have emergency hours on Tuesday and Thursday at the office. Every patient coming in, we're going to charge $9,440. That's an abuse. And the payers are watching for things like that. Or I tell an emergency patient, look, my normal hours are 8 to 5. We'll work in at the end of the day. And when I see that emergency patient, we still stay. We never left the office, and I stay a little extra time to see the emergency patient. And then I bill out $9,440. So those are abuses, but this is a potential code. Now, what if the doctor was open Tuesdays and Thursdays right now for emergency treatment, regular hours, but the doctor makes a special trip on Monday with the assistant specifically for a patient? Yes, code 9440 would be a code we could properly report. If we're out of network, we certainly get the fee. If we're in network, we must carefully look at the EOB. If you're in network, a PPO can deny the procedure. Deny means that they aren't paying, but you collect from the patient. Or they can disallow a procedure, which means you've got to write it off. Many, many offices don't know the difference between deny and disallow, and they just write everything off. And that is not a write-off that we need to make if it is a deny by the payer. Another code is the Dental Case Management Code, Care Coordination. This was asked by the Medicaid folks back there, and we do have this code. It's fairly new, and I won't read what the slide is, but the bottom line is this is where the dentist takes extra time to talk, say, to the patient's physician above and beyond talking to the patient, and then a fee is assessed. So this particular code has very poor reimbursement at this time, does not look like it's trending in a positive nature. So I do want to cover all the potential codes, how they're covered, try to simplify this for us today. Also, I would recommend, this is being recorded by eAssist. I'd go back and listen to this presentation a second time. Sometimes folks listening want to hear what they want to hear, so listen. I'm trying to be very precise in my description of a lot of these codes. Next, let's look at documentation. Do we need documentation of teledentistry? So yes, we do. At the end of the day, the dentist must decide the appropriate charge for the most appropriate situation. So the dentist decides, and it's an individual decision. So this case management code, this could report that consultation between the dentist and patient's physician. Again, we're just not going to see much coverage of that code, and the trend does not appear to be positive at this point. So the trend is not positive. So what about the summary of these teledentistry codes? I've covered the best codes to report based on reimbursement, based on the best reimbursement frequency, and the best fee, which codes pay the higher fee. And of course, 0140 is the one. So our philosophy of charging patients for the various teledentistry reported codes. We'll continue this as we dive into this and give you some strategies as to whether to charge, not to charge, that type of thing. So at the end of the day, what is your best code out of all the codes we've discussed? Code 140. It's the best bet, and what we like about it, the coverage trend is improving, and some payers are increasing the frequency limitation. For instance, some of the Aetna plans are now paying for 4 evaluations a year. Some of the plans are restricting the extra evaluation codes to a 2-month period here. So lots and lots of handcuffs in terms of just exactly how it is paid by a given payer. So what about the philosophy then? Should you charge for code 140? Well, with long-term patients, some dentists may be reluctant. Maybe I'm out of network. I'm charging higher fees, getting better fees. I've had to really work hard. I have no write-offs. Maybe I'm spending extra marketing, certainly extra marketing time, if not marketing money, to stay out of network. I might make the decision that no, it's going to be value added, and so forth. On the other hand, maybe I'm in a PPO, I'm getting killed with the write-offs, and I say, you know, I am going to cover this. So keep in mind, though, at the end of the day, that insurance reimbursement is very good for this code. For new patients, some dentists may charge. Your choice as to charge your standard fee. You could have a fee that is less than your standard fee. Maybe my standard fee is $100. I might say for teledentistry, I want it to be $75. Or I might say I want for teledentistry to be $125. So again, it's your choice as to what is your standard fee for code 140 at the teledentistry appointment. Of course, if I'm in a PPO, then they're going to restrict the fee that I can charge to whatever the PPO fee is. That would apply in most all cases. One other point, and I don't want this to be confused, this is related only to teledentistry, only to telemedicine, but the copays and deductibles may be forgiven. It's optional. And here we have you cite the reference. I want you to listen to what I'm saying, though. I'm talking about that code 0140 at the teledentistry visit. I'm not talking about the patient coming in for their treatment in the office and then doing copay and deductible forgiveness. So in dentistry, we won't see this much, but let me give you an example. Some of the PPOs, if the patient goes out of network, the fee reimbursement might be less. And in some cases, when the patient goes out of network, there's actually a copay. And so, yes, it could be that you see an out-of-network PPO type patient, you're not a member of their plan, there could be a copay. If you wanted to forgive that related to the teledentistry visit, yes. But again, I want to emphasize not the regular visit in the dental office. Also, we have guidance during this period of time. There's a loosening of HIPAA requirements, and so the type of technology allowed, this came fresh from the ADA website, and also some governmental direction. Non-public communication platforms allowed would be smartphones, voice or text, Apple FaceTime, Skype, Google Hangouts, Zoom, Facebook Video Messenger. Now, what's not allowed would be Instagram, Facebook Live, TikTok. Also, technically, you need an informed consent from the patient in order to do teledentistry. Now, is anybody going to sue you over teledentistry? I would think that would be pretty far-fetched, but it is good to get an informed consent. What would that process be? I might email the patient, text them a form for entry into the practice. I might have an informed consent form. I might have a medical history that they might separately fill out. So that's kind of the mechanics of how that informed consent might work. So the types of technology allowed: the HHS Office of Civil Rights says that it will waive any potential HIPAA penalties and the statements. Remember, if I do teledentistry with a patient, they're in their home, a friend or neighbor, a kid, who knows who's in the same room with them. And so there is the potential of overhearing the conversation. There's also a marketing potential. I might meet a potential new patient through the process. They're observing, they're listening to me, they like me. They say, hey, Dr. Blair, I think I might kind of want to come in and see you. Wonderful. So I just want you to know there is some loosening in terms of HIPAA and the HIPAA requirements. Now, let's drill down a little bit further. What about charging for the teledentistry code? Remember, there's two of them, two codes, but the only code we use is 9995, and it's not covered, but a charge is permitted. We are seeing some very, very limited coverage for 9995 and fees in the range of $12, $15. Another consideration might be, is the practice actually paying a separate teledentistry fee? And maybe I've got a charge there. Actually, there's a lot of the teledentistry telemedicine platforms that are waiving any kind of fees at all for the next couple of months. So check your chat rooms, check maybe Dr. Bicuspid, and check and see if there's some particular company that you might be interested in. Another consideration on charging 9995 is, am I going to charge for that in addition to the 140? I told you code 140 is the best. 140, though, does have a limitation, the ADA says, is that it has got to also have a visual means to it. So if I'm the dentist, I call the patient only audio, I cannot bill out code 0140 according to the ADA. I've got to have the video between me and the patient, or I've got to have pictures of their mouth, got to have a visual means, they say. So it's both audio and video required to report code 140. So again, the dentist will decide, do I want to charge both fees here or just one of the fees? The 9992, again, it's rarely covered. Do we want to pile on again? In my office, I would not. I would not charge the 9992. It would just be more of a patient service, talking to the physician, to their physician. What about the patient record? Yes. So we need to put the encounter into our patient record, just like the patient coming into the dental office. So we're going to enter in the patient record the teledentistry code, the appropriate service that we rendered, code 140. We want to put in the record, I had an audio conversation regarding so-and-so, and that we had also a video. Also, we had the patient transmitted some photos to us. All of that would go in the patient record. And so we want to document the reason for this encounter, the diagnosis, the condition of the patient. This establishes the emergent need for telehealth. And again, any transmitted photos, anything like that, would become a permanent part of that patient's clinical record. Okay, very good. I've covered the teledentistry coding, and now I want to present, Sarah, the personal protection equipment, PPE. What's kind of the latest, what's going on with personal protection equipment? There's been a big debate. Should we even have an emergency new code or whatever? The ADA has determined at this point, and again, they're the bully pulpit. They've written all the payers. They've written dental society, state boards. I think everybody out there in ADA has said, would you consider paying for personal protection equipment in this crisis? And could you charge for it? There is no code for it. Could we charge? Yes, it's the unspecified preventive procedure. The unspecified preventive procedure is D1999. So it's a 999 code. That means I need a narrative. Keep in mind, we don't write narratives on the electronic dental claim form more than 80 characters to be guaranteed to get through to the insurance payer at the other end of the circuit. We want to document the PPE in the visit notes. You might automate that you're doing additional PPE above and beyond just the normal OSHA that we have had historically. And remember all charges. Now, everybody knows a PPO has a contract, but few offices unfortunately know that PPOs, every PPO has a contract, every PPO has a processing policy manual. That manual can be 200 pages. It spells out all of the handcuffs, the relationship. And in that manual, what do they require? Virtually every PPO says all charges must be sent to us. You mean even tooth whitening? Yes. We send in the tooth whitening. Are they going to pay it? The PPO? No. But they could control our fee. It could be fee capping for non-covered procedures. So you must send in the 1999 charge if you're going to charge the patient. You've got to put it on the claim form. And then the PPO at that point, they can either deny that charge. That means you do get the patient to pay. They're responsible. Or they disallow, which means you've got to write it off. Keep in mind that Delta Dental has two processing policy manuals. In North Carolina, we have the North Carolina Delta Dental Manual, and we have the Delta USA Manual. It's the national manual for a national contract. An example of a national contract would be Walmart in Arkansas signs a national contract with Delta Dental Plans of America, and then when that Walmart employee walks into the North Carolina office, then that Delta patient is under Delta USA. The two manuals are fairly close to each other, but there are some differences. So be sure that you get the processing policy manual of every PPO that you deal with, because they spell out the handcuffs and so forth. So most of the PPOs are going to disallow the PPE charge. Now, we also have been informed that some of the payers are paying for the extra equipment on a different basis. I've been informed and saw a video by the dental director of Connecticut and New Jersey, Delta, I believe they're commonly owned, and they indicated they were going to pay $10 per unique patient encounter. So at the end of the month, they add up the claims for the different patients seen, and then the doctor gets a separate check. Now, to be paid by those deltas, you've got to be in network, and I believe you've got to have the electronic where the EFT, they call it, where the Delta can put that money automatically in your checking account. Also, I understand that some of the other Deltas are very close to adopting something very similar. So stay in touch there. It may be that the PPE is paid with a separate check. You do not have to put D1999 on the claim. Other payers, you may have to put 1999 there. It's up to you. Do you want to charge this extra or not? Again, it's that decision of the doctor. We know right now that the PPE equipment is sky high. It will return down to commodity values, but for right now, it's really in short supply. So it's up to the doctor again. Am I going to charge, for PPE? We all know that the biggest economic aspect to this, as dentists come back online, is seeing the patients one at a time. Think about that doctor, that very busy doctor dancing among 6 operatories, checking a couple of hygienists. How are they going to come back online? Well, it looks like it's going to be one patient at a time, and I think that's going to be the economic hit for the profession, much more than just an extra $20 a visit. Now, I don't want to say that's minuscule. Every dollar counts, but I think that economically, the real big hit is going to be the change in efficiency as we come back online. Okay, before I get into the Q&As, the last thing I wanted to discuss was the certificate of waiver. The ADA is going to release 2 new codes, June 1. One of the codes is for the in-office antibody testing, and that is something that you've got to send off and may take a while to get the results back, or possibly a chairside testing for the virus. And we will have 2 new codes. Now, what this makes the office is a testing laboratory, and it's subject to CLIA, capital C-L-I-A, and you need a certificate of waiver if you're going to run testing in the dental office. And so this certificate of waiver, it costs $180 for the federal certificate. It's 2 years, and you need to deal with your state health department, go to the website and see which division is CLIA, and you need to go according to their rules. Other states, there's 2 or 3 other states where there may be a separate state registration. For instance, California, you're going to have the federal fee that you pay plus an additional $113. So if the dentist is doing saliva testing, oral surgeon is maybe doing for certain anesthesia procedures, even a pregnancy test, any testing in the office, you need that certificate of waiver. You're a low-level laboratory. There's several levels of licensing, and in the dental office, we're using tests that have already been approved. North Carolina tells me that they can generate a CLIA number in 24 to 48 hours. Other states, I was talking with the California representative out there, looks like they may be 4 weeks. So just right now, let me put that on your radar. If you are planning to do testing in your office come June or later, at some later time, go ahead and apply for your certificate. Now, go by your own state guidelines. There's a federal form, a CMS 116 form that is filled out, then submitted to your state agency, but go by what your state agency says. We don't have the research to know what each and every state requires. Okay, Sarah, I guess you heard all of it. So
I did.
it's all right. Our technology is working.
Yep, we stayed connected the whole time. Thanks, Dr. Blair. That was great. We do have a lot of questions that we've got for you here, so I'm just going to start at the top and read through them if that works for you.
Okay, and let me also say I have my colleague, my call center supervisor. Many of the people on the call know of Delane Glecki, so she's here to chime in. Also, let me say too, I know we've got the eAssist clients aboard. I'm thrilled. And remember that as an eAssist client, you get access to our practice booster online. And so you've got full access to look up any of the codes, anything in the world you want to. I would direct you to our blog, BLOG. Actually, to get there, you don't have to be a member. But every eAssist practice is a client, and you have access, full access to the Practice Booster platform. So go to the blog, and on the blog, we've got several articles there. We have a teledentistry article, we have a PPE article, we have the certificate of waiver article. You can read in depth there and give you additional information. We're updating those articles on a weekly basis if there's any changes, trying to stay abreast of any changes. So let's get into some of the questions, and Delane, you feel free to answer any of these as the questions are posed.
All right.
Thanks, Delane. All right, we have a question here about what if a hygienist is conducting a call? Is there a code to use for that?
Well, I actually indicated that. You certainly could not use code 140 if it's a hygienist in the dentist office. Now, there's a few states where hygienists can practice independently. There, according to their state laws and so forth, it may be they can charge for the code 140. But if I'm a North Carolina dentist here, as an example, or most of all the other states, and my hygienist talks to a patient, then I could not charge code 140. It would be that 09999 code, or the screening code, code 190 screening. And again, there's just little or no reimbursement. I don't know the taste in the mouth of patients if, if we were charging with the hygienist.
Gotcha. Okay. Yep. All right. The next question we have is for post-op calls, what code should we use? And I think some of these may have come in before some of your slides. So if you had already answered them, they're just probably a good idea to reiterate a few of them for folks, if that's okay with you.
Well, a post-operative code, a post-operative office visit type code, 191 is the one that we are correction, 0171. 0171 would typically be the code. There's also a 9630 code, an office visit for observation, no other services rendered. Some people use that code, but I kind of like 0171. It's typically no charge, where the patients come in the office. It's a follow-up, maybe a post-op to a denture or remove a suture for an extraction.
Great, thank you. Another question we have here is from Belle. She said, if the state is only allowing emergency care and a dentist performs a crown prep because the tooth is cutting the tissue, but the insurance company refuses to pay for the services because the service is not emergency, can they refuse payment on the service?
I don't think that insurance companies want to get into this game. They're not going to sit there and say, well, a North Carolina dentist can do this and a Kentucky dentist does that. And also, under an emergency situation, it may be that a crown prep would be appropriate in a certain emergency, situation. So I don't anticipate, if you do a service and bill out the insurance company for that service, and the teledentistry code is not going to be on that claim, it's just going to be a regular claim going in for a crown. I can't imagine companies trying to say, oh, you did that in a state at a particular time, you couldn't do that crown prep. So I don't see that.
Yeah.
I don't think that's on the radar.
They
don't have the labor to be picky like that.
Absolutely.
Or to even track it.
Yeah, we did a poll with some of our eAssist team members, who, certainly not a scientific poll, but we have thousands of claims being filed, obviously, by our team members every single week. And I think 99% of our team said they had not heard any kind of failure to pay due to state closures or any state mandates preventing dentistry or anything along those lines. So 99% had seen no issues with that.
Excellent. Yeah, I would think that that's just extra labor, and insurance companies, they're interested in automatically processing the claims and getting claims paid. They really don't hold money. Sometimes dentists think that insurance companies try to hold back the money. They really don't. Most claims are self-funded claims, and that means the insurance company just gets paid to pay the process of the claim, self-funded, and actually it's not the insurance money at all. It's 100% of the employers.
Great. Yep. All right, we have another question here. Will teledentistry be paid if the services are billed out as medical codes with proof of medical necessity?
Well, now we've got a real medical expert here. Delane has her full medical certification, been through the long process, and so I'm going to let Delane answer that one.
Hello, everyone. So it depends on what the medical necessity is for that. So it's going to be dependent on whatever your services were that were performed via teledentistry, and if they meet the medical plan's criteria for medical necessity. And that's going to be communicated through your ICD-10 codes applied to the claim.
Yeah, and that medical claim, remember, you've got to have the diagnostic codes, you've got to have the procedure code, and then on the medical side, remember that it's got to be covered, specifically medically. And so sleep apnea, as an example, is covered. But in the medical world, the killer is a lot of times, it's a double whammy. Either the procedure itself is not covered, or they're sitting there with a $2,000 deductible that has not been met, and it is covered, but you've got that $2,000 deductible sitting there. So medical is a lot trickier. I don't see a whole lot of application right now on the medical side, but you've got those constraints that Delane indicated.
Yeah.
Dr. Blair, so I can see it being paid under medical during this period of time if you performed an evaluation due to trauma via telehealth. That would be one example during this pandemic that I can think of that I think would definitely be considered for reimbursement under medical.
That's correct. And also, I believe, Delane, that if it's trauma, you can go ahead and bill the company and not report the trauma until later, whereas a lot of your other medical procedures, you've got to do prior authorization before you ever do the procedure. But I think the exceptions would be trauma, maybe taking a biopsy on that medical side.
That's correct, Dr. Blair.
Great. All right. Another question we have is about anything you can tell us for Denti-Cal codes for teledentistry.
Would you repeat the question?
Is there anything you can share with us, any additional information about Denti-Cal codes for teledentistry?
Yeah, Denti-Cal would be, of course, the Medicaid for California, and we're just not up to snuff on all the different states. Just keep in mind that every state has a Medicaid manual. They've got a processing policy manual. So I would go there to Denti-Cal and also look at the website and just see they may have posted certain exemptions and things during this period of time. So I'd go to the Denti-Cal website to get that information.
Great. Just to clarify, Maritza would like to know, when you're submitting a claim, we can bill for D0140 and D9995 in conjunction or as an alternative.
You can charge them both out. It's your option. Do you want to charge for each of those? The teledentistry fee, $9995, might be somewhere in that $10 to $15 range. Again, we're not suggesting an absolute fee here, but yes, you could charge for both, or you could charge for just the code 140. It's, again, the dentist. It's the choice of the dentist.
Eric wants to know if you anticipate teledentistry or in-office antibody testing being a long-term trend or something that we only have during this pandemic available for dentists.
I think that, until we get a vaccine, and I'm no expert in this, but I think that dentists will be running these tests, for the foreseeable future, not just for the short term. But I think a lot of the payers are just kind of tiptoeing through the tulip, so to speak. Right now, most of them are saying we're going to do this for the next several months. It could be that can be extended depending on how the pandemic, works out. But I think these codes of checking will be for much more than 2 months. And I think, too, that the test, are they really going to be available to dentists? The chairside test, will they be readily available to dentists come June 1? And I'm just kind of doubtful of that. I know they're bringing out, ramping up all the testing, but I think it remains a question, will dentists even have the test to give as of June 1?
Right. Yep. Another question we have here regarding teledentistry is obviously a lot of these changes and information have come out due to the pandemic. Once this pandemic has passed, do you anticipate that the teledentistry codes will still be honored? An example given here is, let's say we are on vacation and an emergency patient calls and I FaceTime and call in a prescription.
Yeah, that's a great question. I doubt it. I don't know. There's some tight fisting here of controlling cost. So I think in the short term, I see some teledentistry neat things for marketing in the future. For instance, I send my dental assistant down to an employer in the area, and rather than me going, and I think there's some marketing aspects of this. I send my hygienist to the employer. She's got an intro camera. I talk to the patient through teledentistry. That could be a whale of a marketing and drive patients. They get familiar with the doctor there. They don't have to come to the dental office. They meet the doctor essentially video-wise. They've got the dental assistant representative there. So I see some real marketing aspects of this once we get past this pandemic issues.
We've got another question here. Do you feel that the charge for the D0140 teledentistry code should be determined by the time spent on the audio-visual encounter?
Well, technically, we'd love to charge for our time, but the reality is that it's really for the service. I would think that it's going to be a 10-minute process, could be 20 minutes maybe at the most, or, the doctor's trying to add value. They might even start talking about cosmetic dentistry or something after you've addressed the patient's maybe acute needs. So I would say that most of the time it's going to be a pretty flat rate, and then it could be 10 minutes, could be 30 minutes.
All right, we have another question here. 9992, consult between the doctor and the implant planning company. Would that be a code that's covered?
No, it would not. Between the doctor and the implant planning and so forth, no, I can't imagine that would be paid at all.
Got it. Okay, good to know. All right, well, we're going to do a couple more questions here. We have another one here from Scott. He asked, if you're doing hygiene exams virtually in your office to preserve PPE, are these exams covered at full benefit with the proper teledentistry code?
I don't think you can do remote hygiene services, with teledentistry. I think at this point it's related to, acute situations. The hygienist could certainly call patients and make a kind of a wellness call and that type of thing, but I don't see any billing there. Also, I might be an Invisalign GP dentist who does Invisalign, or an orthodontist doing Invisalign. I might touch base with my patients teledentistry-wise, but since they're already paying me for their case fee, and they're probably paying possibly even a monthly payment, I think very few GPs or orthodontists would feel like they're going to charge that patient, that Invisalign patient, to check in with them.
Great. Yeah, I think we had one more question here. I believe you said it varies by state, and to just verify that. But Laura was asking how you code for the PPE for Delta in Connecticut and New Jersey. Do you still use the same D1999 code?
No, you do not. Let me refresh that and make that plain. Those two Deltas have announced that they're going to pay a PPE. They're not paying it by D1999 at all. What they're paying it is they look at the total unique patient encounter claims that come in. So if the doctor sees, let's say the doctor sees 200 patient visits during the month with Delta, and the doctor has billed out Delta for those 200 visits. They might be checkups, they might be pulling a tooth, they might be whatever. Then at the end of the month, Delta is going to multiply 200 unique visits times $10, and they're going to send a check for $2,000. It's not a check. but they're going to deposit electronically into the doctor's checking account that extra payment. So Delta, in this case, the two deltas I mentioned specifically, we do not put D1999 on the claim whatsoever. Delta is simply going to deposit a separate fee based on the volume of patients seen. Also, in talking to a few other deltas out there, it looks like there's other consideration of other deltas maybe doing the same way. So I want to emphasize with the delta situation, those two specific deltas, we do not put 1999 on the claim. They automatically pay us based on the unique number of delta patients that we saw, during the month. It could be that other deltas go with requiring the 1999. So again, I have no idea. It is specific, but the doctors could check with their own delta of their own state and just see what the status is. I have a feeling that we'll see more of this from a trend standpoint. One other thing Delta's doing, this is selective. I think they're up to about 10 different Delta states where Delta will advance a $25,000 payment to the office for each practitioner, 25 grand, and it's in the form of really a prepayment. It's a loan, and then they take that money back over the next 20 months and it's paid back a small amount. I think it's interest-free. That's one other program that Delta has. And then I think Delta with their foundations have got some other programs with students and various and sundry things. So, Delta at this point looks like you do not file the 1999 code at all.
Thank you so much, Dr. Blair, for being so generous with your time and answering so many questions. That does conclude our Q&A time for today, everybody, but we do have a few more resources to share with you. So if you have any lingering questions, we want to make sure that you know and understand the resources that are available to you from Dr. Blair and his team of experts. And when I say experts, I don't say that lightly. This is a team of people who really know their stuff and know what they're talking about. This is why eAssist has chosen to partner with Dr. Blair's team here. Dr. Blair, if you want to move over to the next slide, I want to make sure you have a chance to remind all of our, one more for me, remind all of our eAssist clients who may be on the line that you have access to Dr. Blair's Practice Booster product. Every single member of eAssist has access to Practice Booster free of charge to you. eAssist pays for your membership. We include that for free for all of our eAssist clients. So if you are not aware of that, please reach out to your eAssist team member, whoever you have working with you on your team, and make sure that you know how to use that tool. It is very, very powerful. Dr. Blair, do you want to take a minute and talk about a few of the other products and resources you guys offer to help dentists?
Yes, thank you, Sarah. That was well said. We really appreciate our partnership with eAssist, and eAssist has paid a fee for each and every practice to have access to the Practice Booster online. When you go online with Practice Booster, there's a lot of resources there. You can look up any code. You also can look up the Archives of Insurance Solutions newsletter. We put the newsletter out every other month. It's 16 pages. Most of it is original research. And so be sure that you look at those resources of the Insurance Solutions newsletter, also the coding, and then your support is local. Your eAssister consultants will answer any coding, any questions that you might have. And so we're just thrilled for our relationship with eAssist, and they are the leader out there in virtual outsourcing. I think we're going to see even more outsourcing as we go downstream. So Practice Booster, you have this. So you've got practicebooster.com. Go there. You've been given by eAssist a password. You can go. You've got full access to the website. And just a reminder, on the website, if you go to the blog, B-L-O-G, and we're adding a banner any day now, you can look at the latest COVID articles about all the topics we talked about today. There's articles in depth about it to give you further information. Also separately, you can order our Code with Confidence book. It's the gold standard in coding. We've got the administrative book. This is the one, folks, that you need. All the ins and outs of dealing with PPOs, how to handle dual insurance. There's so much in this book. It's about 600 pages, plus in the book is a password to go online and get even additional information with the landing page, we call it, in addition. So this admin book, I cannot emphasize enough. Get that. You'll love it. Every doctor listening, the doctor should read this also. Do not hand this to your dental team. You want the doctor and the dental team need to read the book and really get on the same page, because I don't want you writing things off when you're in a PPO that you do not have to. And I want you, if there's dual insurance, to collect the fee up to the fee you submitted. So if I'm in 2 separate PPOs, under the best of circumstances, I can get my full fee. So the PPOs are controlling what the patient pays, but the secondary payer controls how much total money I make. And under coordination of benefits rules, and particularly with insured plans, when they are the secondary payer, I might get my full fee. We also have a bundle. You can get the two together. Go to the website. You can see the bundle pricing. We're also giving free shipping at this point. And then we have our medical book. Delane and Glenda were just instrumental in designing this book. It's a monster 860 pages or so. And stay tuned. We have had our classes in Charlotte have been overloaded, trying to get into our 2-day medical coding. Stay tuned. We may be able to make that a virtual online program, and we'll let that know. And then the eAssisters will hear about that, and we'll let everybody know. So these are the other products, and I would encourage you, you've got the free membership in Practice Booster. Go online and see what's there. It's a mountain of information.
Absolutely. Yep. It's a great resource. If you have not done it yet, please go do it. It is absolutely free to every eAssist client. eAssist covers all of those costs for you, and it's because we know this is really valuable information. It's another way that we work to deliver peace of mind to all of our clients, is to give them the opportunity to really know that their codes are always on point. That being said, Dr. Blair, I want to thank you and thank Delane, for your help and your assistance today, all this great information. Everyone who is on the call today, we will make sure that this recording, including our intermission with our comedians, is shared with all of you guys today so we can relive that fun together. And we will also make sure that the slides are shared with you, as well as any information for getting your CE credits. So all of that will be emailed to you guys within the next 24 hours. If you have any other questions in the meantime, you can see here on the screen the email for the Practice Booster team is info@practicebooster.com. That'll go to Dr. Blair and his team of talented experts. And if you have any questions for us at eAssist, or if there's anything else we can do or other topics you'd like to make sure we cover on future webinars, please don't hesitate to reach out to us. You can contact your team directly at eAssist, or you can always feel free to email us at news@eassist.me. Thank you guys so much for your time today. We really appreciate it, and we hope everyone has a great weekend and stay safe.
Thank you.
Thanks, Dr. Blair.